Why is endoscopy important for gastric adenocarcinoma diagnosis? Imagine trying to find a tiny problem inside your stomach without opening it up. That's where endoscopy comes in. It is a vital tool for diagnosing gastric adenocarcinoma, the most common type of stomach cancer. This procedure allows doctors to see directly inside the stomach lining, giving them a clear view of any suspicious areas. Early gastric cancer can be very subtle, and sometimes it's hard to spot on imaging tests like X-rays or scans. But with endoscopy, physicians can identify even small or flat lesions that might indicate early cancer. Detecting cancer early is crucial because early-stage gastric adenocarcinoma is often treatable with less invasive procedures, leading to better outcomes. During an endoscopy, the doctor inserts a thin, flexible tube with a tiny camera into the stomach. This camera provides real-time images of the stomach lining, helping doctors spot abnormal growths or lesions. If something looks suspicious, they can take a small tissue sample, called a biopsy, right then and there. Analyzing this tissue under a microscope confirms whether the lesion is gastric adenocarcinoma or another condition. Without this biopsy, a definitive diagnosis cannot be made, making endoscopy essential for accurate detection. Advanced endoscopic techniques further improve diagnosis. High-definition cameras, special dyes, and magnifying tools help differentiate cancerous tissue from benign conditions. These methods also help determine how deep the tumor has invaded the stomach and whether it has spread to nearby lymph nodes. Knowing the extent of the cancer helps in planning the best treatment approach, whether it's endoscopic removal or more extensive surgery. Endoscopy also plays a key role in guiding treatment decisions. For early cancers confined to the surface layers of the stomach, procedures like endoscopic mucosal resection or submucosal dissection can sometimes remove the tumor completely. These options can be less invasive and have outcomes similar to traditional surgery. Additionally, after treatment, endoscopy is used to monitor patients who are at high risk or who have had early gastric cancer removed, helping detect any recurrence or new lesions early. Another important aspect is endoscopic ultrasound, which combines ultrasound imaging with endoscopy. This technique allows doctors to assess how deep the tumor has grown into the stomach, and whether it has spread to nearby lymph nodes. This information is vital for staging the cancer accurately and deciding whether additional treatments like chemotherapy are needed before surgery. In summary, endoscopy is a cornerstone in the fight against gastric adenocarcinoma. It helps detect the disease early, confirms diagnosis through biopsy, characterizes the tumor, and guides treatment. Advances in endoscopic technology continue to improve its accuracy and usefulness, ultimately helping patients receive timely and personalized care. Always remember, if you have symptoms or risk factors for stomach cancer, consulting a healthcare professional for proper evaluation is essential.